Today, we're here to talk about an individualized approach to food allergy and intolerance management. My name is Amy Chow. I'm a registered dietitian based in BC, Canada, and I run a private practice called Chow Down Nutrition, where I see clients that are suffering from food allergy and intolerance and help them optimize their nutrition and manage their dietary goals. And in this presentation, I'm going to cover what are the differences between food allergy and intolerance. I'm going to cover some of the common dietary interventions and management goals around these conditions. We're going to cover some limitations around food allergy testing and understand why it's important to use an individualized approach in managing these conditions. Last but not least, to appreciate why it is important to work with a dietitian in terms of elimination and food reintroduction, as well as managing these conditions. So what are the differences between food allergy and intolerance? Food allergy is a reaction that involves your immune system. Your immune system is reacting to a food protein or the allergen that you have ingested. And so symptoms can range from rash, hives, vomiting, diarrhea, and can lead to anaphylaxis, which can be a life-threatening condition. There are many different types of food allergies, and they're usually classified based on the pathway that they're involved in. So IgE-mediated allergies, mixed IgE cell-mediated allergies, non-IgE-mediated allergies. Some examples would be your milk and soy protein allergy, your oral allergy syndrome, EOE, and FPI. Whereas food intolerance does not involve your immune system, it is not life-threatening, and it oftentimes involves your digestive system. So a lot of gut symptoms like bloating, cramping, diarrhea, excessive gas, for example. And some example would be lactose intolerance, so your body isn't able to break down lactose completely, fructose intolerance, and IBS symptoms. These are the list of priority food allergens in Canada, and they account for about 90% of allergic reactions. So we have eggs, milk, mustard, peanuts, shellfish, fish, sesame seeds, soy, tree nuts, wheat, and triticale. And sulfites. Sulfites are not a true food allergy, but they do cause food allergy symptoms in people who are sensitive to them. So that's why they're included in this list. In terms of priority food allergens, it's important to know this list because these foods need to be labeled under their common names under the enhanced labeling law in Canada. And so it makes it easy for people to locate and avoid a certain food allergen and find safe options for them. In terms of food allergy testing, there are a couple of options for IgE-mediated allergies. So we have our skin prick test, where the allergist might scratch the skin with a potential allergen and see if a reaction develops. We have the IgE antibody blood test, where the doctor or allergist might test for IgE levels of antibodies to that specific food protein. And it can also be used to monitor over time to see when is a good time for an oral food challenge if you're allergic to a specific food. It is important to note that a positive skin prick test or a positive IgE blood test does not necessarily mean that you have an allergy. Oftentimes, the history is the most important tool to diagnose food allergy, because if you had any previous reactions or potential reactions or reaction to an oral food challenge, that really gives a good indicator if you're allergic to a specific food protein or not. So the oral food challenge is the gold standard in terms of diagnosing IgE-mediated allergies, and they're often only done in allergist office where they can treat the anaphylaxis reactions appropriately, because that can happen if someone is potentially allergic to a specific food. And then in the market, you will find all these unvalidated food allergy testing. So the most common one that I see is the IgG food panel testing, where they test for IgG antibodies in your blood against food proteins. There is no validation around IgG antibodies indicating any food allergy. In fact, IgG antibodies are used to monitor tolerance. So people who go for these testing often come up with a lot of positive IgG antibodies to foods that they're regularly eating in their diet. We have hair analysis, so taking a sample of your hair to determine the food allergen. Vega testing, which is the picture shown here using electric current when you're holding the food allergen. Applied kinesiology, testing your muscle strength while you're holding the food allergen, and then cytotoxic test, which is taking an sample of your white blood cell and see how it reacts with the food allergens. All these testings are unvalidated, so they should not be used in the diagnosis of food allergy or intolerance. And so consider this case study here where someone had the diagnosis of alopecia, ankylosing spondylitis, and she had a food sensitivity done, of 144 food panel of IgG antibodies. A lot of them came back positive for her, and specifically foods that she's already eating in her diet. She was told to avoid these foods for at least 18 months on top of a candida diet that she was prescribed. So lots of restriction in her diet at this time. She was told to minimize gluten, sugars, starchy foods, and fruits. And so when I met with her, her diet was very limited, and she was getting pretty frustrated with all this restrictions. She was also starting to question herself if she needed to follow all the restrictions because she didn't notice any improvements in the symptoms. So we worked on adding foods back gradually and monitored for symptoms. As she added foods back in, she had more confidence that these foods did not correlate with increased symptoms. At the end of our sessions, she was eating most foods except for limited dairy. Her diet is much less restrictive than before, and she is able to incorporate a variety of foods back into her diet. So just really important to note the unvalidated food allergy testing that she has done, and especially for conditions that are not related to food allergy or intolerance. In terms of dietary interventions, there are really two main goals. So the first one is to help prevent any adverse reactions to food allergy or intolerance. And a couple of ways that we achieve that. The first one is early food introduction to help prevent food allergy, especially in high-risk babies and young children who may have a sibling or family member with food allergy, or they already have another atopic condition such as eczema. We want to be validating someone's lived experience and struggle because each case is very different and unique. So listening and validating the story, helping people avoid offending food allergen, helping them learn label reading and understand the regulations in Canada, helping them understand their cross-contamination risk. In some cases, cross-contamination needs to be avoided. In some cases, it might not be as important. Helping them understand and make sense of their reactions and symptoms, and plan effective elimination and food challenges if this is deemed appropriate in the outpatient setting. So all these can help prevent adverse reactions. The second goal really is to improve quality of life. So these people usually come with a list of restrictions, fear and anxiety around eating and food because they feel like some of the foods might be causing the symptoms or causing them to feel unwell. So helping them optimize nutrition despite restrictions, explore substitution, not just taking food out of their diet, explore new recipe, new ways of cooking, new food and meal ideas, helping them navigate social situations such as eating out, traveling, or managing family situations, helping them increase their knowledge and confidence in managing the conditions themselves, and avoid any unnecessary elimination, such as the unvalidated food allergy testing or eliminations that they might be following for a while, but really has made no difference in their symptoms. So continuously re-evaluating their tolerance in terms of food allergy and intolerance, because sometimes things can change over time, and helping them navigate health professionals that might be able to help them with that. Last but not least is helping people enjoy food and eating again. That is so important. So consider this breastfeeding mom who had a 3-month-old baby with blood in his poop. The baby was diagnosed with allergic proctitis, so the mom was recommended to eliminate milk and soy from her diet. Baby still had blood in her stool, and then she was recommended to further avoid all top allergens. So the priority allergens that you saw on the previous slide. Baby still had blood in her stool, and mom really wanted to continue breastfeeding, but she didn't know what she can eat at this point. And she was also really stressed out about the blood in the stool. So when I met with her, we had discussed about the subgroup of babies who may not respond to dietary treatment. And I encouraged her to discuss with her pediatrician if breastfeeding was still appropriate to continue with monitoring baby's weight and growth, or she can consider the use of hypoallergenic formula. We added in a lot of supplementation to help with her nutrition because she was having a lot of restrictions in her diet, and discuss allergy-friendly substitutions and finding these options. She had continued to avoid milk, egg, and soy, but gradually added other foods back in one at a time because she did not notice an increase in symptoms. So when it comes to elimination diets, we want to consider the effects that it would have on someone's diet. So consider this really standard diet, for example, with milk and soy elimination. They might be taking out the cereal that could have milk or soy ingredient in them, as well as the milk in the morning. And sandwich, the bread could be containing milk or soy, as well as yogurt. Cheese and crackers are gone. Teriyaki sauce and the tofu will contain soy. And then, of course, milk is gone from the bedtime snack. So the diet becomes really limited if we don't look for substitution. A more appropriate way to approach elimination diet is to help people find substitution, making sure that you're finding appropriate alternatives to still enjoy a varied and nutritious diet. So finding soy-free, dairy-free options for the cereal paired with a fortified milk alternative. Finding soy-free, dairy-free bread for the sandwich, pairing it with hummus instead of the yogurt. Finding a vegan cheese and soy-free, dairy-free crackers. Substituting the tofu with garlic beef for the rice bowl. And then again, using the fortified milk alternatives for the bedtime snack. So each allergen that is eliminated from the diet can have potential implication in terms of nutrition and lost nutrients. So we really want to consider what are we missing from their diets. A lot of the times it is the calorie and the protein from a lot of these foods. In terms of multiple food allergen, is even more important to consider alternatives or substitution, because you can see it can quickly affect someone's nutrition status. So for milk, we have fortified milk alternatives to consider. Depending on the person, it might be more suitable to use some options than others. And then the protein can be replaced by other protein options. Eggs, we want to consider egg-free products that are available, like bread or pasta that someone might have trouble finding. We want to consider how to make baked goods without eggs, so using flax seeds, banana, applesauce, for example. Soy is in a lot of vegan, vegetarian food, as well as just a lot of food products in general. So helping someone navigate and find soy-free bread, crackers, particularly if someone was vegetarian as well, finding other options for protein, and finding soy-free options that are convenient. Wheat-free products, finding alternative grains, and teaching someone how to use them appropriately in the diet. A lot of people haven't cooked with these other grains, so it might be important to learn. Peanuts and tree nuts, finding nut-free seeds and seed butter, nut-free granola bars as an option. And then for fish and shellfish, finding other sources of omega-3, such as algae, seaweed, nuts and seeds, or supplements. So consider this individual who had an IBS diagnosis. She was dealing with her symptoms for over 10 years with bloating, excessive gas, cramps, and diarrhea 2-3 hours after she eats, and bloody stools at times. When I saw her, she had a negative celiac screen and no gastroenterologist referral. No scopes were done at this point. So when I met with her, I first advocated for GI referral and further medical investigation because of her bloody stool. In terms of diet, we worked on regular eating times and a low FODMAP elimination for 6 weeks, where her symptoms did improve a lot. She was eating a vegetarian, almost vegan diet, so it was quite challenging for her to get enough protein. So she had added eggs back in as a protein option because she was having a hard time feeling satiated for the day. She wasn't able to reintroduce any high FODMAP foods back because all of them cause symptoms. But now she knows which foods will cause symptoms, and sometimes she chooses to enjoy them, knowing that she might have some symptoms later on. And eventually a GI referral was done, and colonoscopy indicated that she was suffering from colitis, and she was started on a course of prednisone and biologic. And we had talked about that once her inflammation is under control, we might be able to reintroduce some of these foods back from the high FODMAP list that she might be able to tolerate and expand her diet. So if you are a healthcare professional working with someone dealing with food allergy and intolerance, again, just making sure that we are using an individualized approach to validate someone's experience and struggles, referring out when it's appropriate. So allergists for allergy diagnosis, gastroenterologists for any unexplained gut symptoms, and dietitians for any nutrition concerns, and to ensure that the diet is adequate. We want to be avoiding any unnecessary restrictions. And so if you are recommending any restrictions or elimination, make sure that you are following up with the clients so that you can reevaluate if the restriction was necessary, and as well as following up in the future to, as things change or conditions change, to see if these restrictions are still necessary. We want to be offering culturally relevant recommendation and food substitutions, as we have seen how substitutions play a huge role in allergy and intolerance management. If you are someone suffering from food allergy and intolerance, making sure that you're asking questions if you are ever not sure about a food product or eating out, keeping an open mind to explore new food options and recipes, and learning new ways to cook. Be wary of unnecessary dietary restrictions that are recommended to you and the unvalidated food testing, as we have seen. Be curious, because your food allergy and intolerance can change over time. So finding professional support that are knowledgeable in this area can help you manage these conditions over time. There are a couple of great allergy-friendly resources and websites, with the first one being Food Allergy Canada. They have lots of evidence-based information on their website in terms of managing food allergies. Allergic Living is an online magazine. They have a lot of great recipes that are allergy friendly, as well as evidence-based information. We have a food allergen substitution chart from Foodology Canada that is worth looking at if you are following any elimination. And here are some further resources to learn more about this topic on food allergies and intolerance. And here are my contact information if you have any questions or want to stay in touch. Thank you so much for having me in this presentation.